Welcome back, everyone. Today we're going to talk about arthritis, specifically how to approach joint space narrowing on imaging. Step 1. The big picture. When we see joint space narrowing, our first task is to figure out whether the cause is degenerative or inflammatory. Degenerative changes are usually asymmetric, with osteophytes and sclerosis. Inflammatory changes are often symmetric, with erosions and soft tissue swelling. Step 2. Degenerative pathway. Let's start with the degenerative side. The most common is typical osteoarthritis. Wear and tear changes, usually age-related. Sometimes, however, the pattern is atypical. Maybe the distribution is unusual. The disease is too severe for the patient's age, or it doesn't fit the classic pattern. In those cases, we should think about trauma, crystal deposition disease, like gout or CPPD, neuropathic arthropathy, or hemophilia. Step 3. Inflammatory pathway. Now let's move to the inflammatory side. Here, the key question is, how many joints are involved? If just one joint is affected, think infection. If more than one joint is affected, we look at the pattern. Proximal joints, no bony proliferation, that's rheumatoid arthritis. Distal joints with bony proliferation, that points to the seronegative spondyloarthropathies. And within this group, we divide further. Axial SPA includes ankylosing spondylitis. Peripheral SPA includes psoriatic arthritis, reactive arthritis, and IBD-associated arthritis.